Hi, and welcome back to Pills and Bills. I'm a practicing clinical pharmacist with a passion for teaching and an even bigger passion for paying off my crippling student debt. I did design this top 200 drugs coloring book by myself to help med, nursing, pharmacy students and techs learn smarter. So grab a pencil, let's color, review, and make these drugs stick together. If you'd like to color along with me, this book is available on Amazon and TikTok Shop. Just search Top 200 Drugs Simplified. And with that, let's begin. Alright, today we're going to be covering gabapentin, or Neurontin, which was originally developed to treat seizures, but over time it's evolved into one of the most commonly prescribed medications for neuropathic pain. It is classified as an anticonvulsant, despite its multiple indications. Next, we have our PharmaLink phrase. This is a quick memory hook that connects the brand name, the generic name, and the drug's key idea, along with a picture to make it really stick. Interestingly, gabapentin's chemical structure is actually a modified version of the neurotransmitter GABA, which is why it can travel so easily into the central nervous system. Gabapentin is FDA approved for the adjunctive treatment of seizures as well as for post-herpetic neuralgia. Of note, it's estimated that 95% of gabapentin prescriptions are actually for off-label uses. These can include anxiety, migraines, fibromyalgia, diabetic neuropathy, and hot flashes. It's recommended to take gabapentin with food to improve absorption. Food slows absorption, and because it relies on a saturable transporter, meaning only so much can be absorbed at once, taking it with meals helps drug levels stay more consistent. Okay, mechanism. Despite it being modeled after GABA, gabapentin actually binds to calcium channels in the CNS. This reduces calcium influx into neurons, which in turn lowers the release of excitatory neurotransmitters that drive seizures and pain. Moving to side effects, the first is ataxia, or unsteady movement. This happens because gabapentin slows neuronal firing in regions that coordinate balance or motor control. Blurred vision may occur as gabapentin affects signaling in the visual pathways, slightly slowing communication between the eye and the brain. And somnolence, that sleepy, drowsy feeling, comes from gabapentin's broad calming effect of the central nervous system, lowering neuronal excitability across multiple pathways. Dizziness may result from overall CNS dampening. Gabapentin reduces excitatory transmission, which can make you feel off balance or lightheaded, especially when starting therapy. Moving to warnings, gabapentin should never be stopped abruptly, especially in patients using it for seizures or with a history of seizures. Sudden discontinuation can trigger withdrawal or even provoke seizures because the nervous system suddenly loses the stabilizing effect that it's gotten used to. Tapering the medication gradually is the safest approach. And that completes our review. See you next time.